Hi, my name is Mia, and I am I'm trying to make my intro video for YouTube, and it hasn't worked yet. I don't know why. Anyways, I just wanted to say that I'm not feeling well today. I'm a naturopathic medical student, and I have 2 children. They're sick today, and they're missing school, and I have required classes. I was going to attempt to make a doctor's appointment and pay a lot of money and spend several hours traveling to and sitting in a doctor's office, but I decided after some prayer that I just need to go to the classes, because even if you get a doctor's note, you need to make them up. If there's no attendance, then you need to end up, I guess, getting a recording and having somebody listening to it for 2 hours. So, anyways, I just want to get this stuff done with. I want to make a video so that I can introduce myself. I'm living in Oregon. I have about 1.5 years left of medical school if things go well. Only thing I'm really behind on is the observation hours and the electives, which I don't know. I don't know what's happened to me in the past. I just haven't looked at the schedule. I haven't looked at the deadlines to see, for observation you can sign up for shifts. For the electives, you can sign up for them. There's weekend classes. It wasn't until recently one of my friends who's actually already a medical doctor, she's always, oh, look at these electives, look at this, look at that. Like, oh, I never really thought of that. Or we need to change our schedules around so we can fit this in, or have some time to, actually go home and get our kids from school. So I've been trying to pick up the pace on that. This is the first year that I've had 2 clinic shifts in a term. So for fall and winter, which we're still in winter, I've had clinic shifts, and I like it. That's my favorite part of the week. The shifts have been a little slow, but some of them aren't slow, but for some reason my patients cancel or something happens. But you can still get your clinical requirement checkoffs by, for instance, last night I explained the use of oxygen. I had to kind of be quizzed by our supervising physician, Dr. Wilson. I had asked him last week, and he said I needed to explain it without looking at my notes. But I decided to look online since I had 4-hour shift and only 1 patient. I ended up going ahead and look online, took some notes because that helps me learn and try to separate. We learned this stuff in the minor surgery class, but it helped me separate everything that was going on. So then I brought my clipboard and notes, and he isolated me from the rest of the group, I guess, so that they couldn't just copy what I said and get the same check off. And it was like, first you use, the first thing on my list, he asked me, okay, so this happens. I said, oh, you use this type of oxygen administration, the nasal cannula. And then for the next one, I was, oh, what's the next thing on my list? Face mask, And then he took my list away. So then he had, oh, what if that doesn't work? What can you do? The only other thing I was thinking of was, what else was on my list? I mean, I was surprised that I was able to answer the questions. And this teacher, he's an older person. He likes to talk about duct tape every time he's teaching. So at the end, of course, he said, okay, your patient's anxious. If you're giving an oxygen, it's not working. How are they going to look? He's like, to find out how anxious you would be, put duct tape, over your mouth and over your nose with a small pinhole in the middle. Run up and down the stairs a few times. And that's what your patient feels like when they're not able to breathe. So I'm glad that he threw in that little duct tape thing. I thought for his exams last year that I would. There's 3 things with his exams if you don't know the answer. If you usually always know the answer. It's like, cats, for some reason, he always talks about cats, he always talks about duct tape, and he always talks about, call 911. So, what's the first thing you're going to do? What's an emergency? Call 911. So, anyways, that was humorous. At least it made me laugh. So, yeah, rainy, dryish, rainy outside here where I live. Birds are chirping, the kids are not feeling well. I'm a single parent. I have my kids 365 days a year. There used to be occasion where our friends would take them overnight. Usually that was more when they were kids, little kids, where they couldn't stay home alone. And even a little bit older, they would go to this family's house so that they could have something to do. But, my daughter wants to do her homework on her computer and have her space and her food. And my son, I don't know. He's 11. I don't understand him. So that's all I want to do for now. I'm working on my skills of uploading and actually having my devices and my microphones and everything working. So I guess it's time. For this time, I made a decision as of yet to go ahead and go to my school so that I don't have to be penalized or make up things. Son was sick last week. He's been sick on and off, but he was sick enough that I had to come home and miss several things. The week before I had to take him in to the doctor, and I'm not used to missing days, but it's really exhausting catching up, doing extra classes at 8 a.m. and having to reschedule tests and into some sort of break, which my schedule doesn't have many breaks. We had class 7:30 yesterday, 3-hour class. As soon as that was done, we went straight to the lunchroom. Didn't eat lunch, of course, and studied for the 40-minute break that we did have. We studied the whole time through with it, went straight to class. And, I don't even have time to go in and out of my locker. I just carry all my papers around with me. There's occasions where there's more breaks, but there's deadlines, and there's an application for a mentorship for the whole year that's due on the 14th. There's midterms coming up for the next 2 weeks. So even during breaks, if you go in the library to study, you're not allowed to eat in there, so you kind of miss your lunch break. And I don't know. Teachers talk about us nibbling through class, and some of them say it's not healthy. But when you don't have a lunch break, you have to go from this place to this place to work to clinic. You're not really able to eat. So at least eating through class, snacks, helps you to at least have some sort of metabolism. My metabolism would be at nothing if I didn't eat. But anyways, thank you for watching, and hopefully I will have this video up sooner than later, and there'll be more topics, specific health information. A lot of my blogs and websites, which I'll share, are mainly about my journey as a medical school student and being a single parent. And I keep telling myself, well, how come nobody helps us? And there's a lady that helps for the past 3.5 years. She's been helping take my kids in the morning and occasionally after school, because of my schedule is sometimes outrageous, doesn't match up at all with the kids' daycare or school schedule. So I really appreciate this lady. And it's just amazing how many people I ask for help that say no, I don't have time, it's too much stress. And I'm always rushing place to place to place. And I feel bad that I'm not helping others very often. When I try to help others, I try to tell them about discounts at my clinic where you can come in, get a naturopathic visit. Sometimes there's free sessions. We have 45-minute naturopathic sessions coming up on the 23rd of February. We have, for new patients, we have 75-minute acupuncture visits. If you pay out of pocket to a regular doctor, some of them will have a lighter fee for first-time patients, but it's usually going to be at least $130 for just the initial visit. Initial visit for a naturopath doesn't always include a treatment plan because they're trying to get to the root of what's going on. So I've had clinics, first-time patient $50, second returning patient $25. I try to tell people about this in my community. There's I want a real doctor. I want someone who's actually knows how to read an MRI, or I want somebody who can actually prescribe medication. Like, a naturopath knows everything that an allopathic doctor knows, and then some. So that's how I try to give back to the community now, is by sharing this. It's like, you can come to my clinic. I had some shifts hydrotherapy. You can come to my clinic, or you can come, we can do surgeries and biopsies if you're afraid you have melanoma, and we give it to you 1/2 to 1/3 the price that the other medical centers have. And insurance, if you don't have melanoma, they will charge you the price, the $300-something. So you can just pay us. We have it biopsied for $100-something, and we send it out. That's the lab. That's their fee, not our fee. And I'm trying to tell people this, and they just say, no, no, no. And I've seen people that have had melanoma. I mean, I learn everything. When you learn in medical school, it's the same thing. A doctor who's been in practice for 30 years, they have experience, but the basics, the science and the pathologies, we learn the same things, if not more now, because there's more conditions now. My doctors now, my school, my instructors are actually sitting in classes with us because there's so much new information. They're actually taking the same classes, the pharmacology. They're sitting in there, they're raising their hand, asking questions, taking notes. It's kind of nice to see that they want to keep up on actual what medical students are learning, because there's like computers. Computers got big. People didn't know how to use them. But anyways, I try to give back to the community that way. I've invited people over, try to have play dates with kids. Everyone's too busy, and I try to get it something like, I see the other kids around us doing different activities and having birthday parties, and me and my kids, they don't get invited. Very rarely do they get invited. So we kind of just do school, and my son plays games, and we don't have relatives out here. We don't really have friends, and people don't understand that. So when I graduate and I study and I get my license, first of all, my prices are going to go up from a $50, $25 visit. This is where when you have a $25 return patient visit at my clinic, that's giving you two students, at least two. One that's about to graduate any day. The other one, which means they're about to be licensed. The other one is a little bit more time before they're licensed. And then you have 2 licensed physicians. One who's been licensed for probably decades, and the other one, or chiropractors. We have chiropractors, medical doctors, naturopathic physicians. You need to have one of those degrees to be a supervising physician. A lot of people have multiple degrees, acupuncture degrees, licensed massage therapists. The list goes on and on. As far as the medical level, you have 2 licensed physicians in the room with you. So it's not like you're just being seen by a random intern and then been sent away with some life-threatening disease. You have a lot of heads, and even as me as a secondary has more time until I graduate, I caught a mistake last night for a patient who's going to be moving out of town and is not going to have a forwarding address. And there was some chromosomal issues going on, and I had taken notes at the lab. I'm still getting used to the lab. We have our own lab in our clinic, blood draws and UAs and all that. You can get genetic testing, anything you can get done at our lab. And I had the lab attendant, whoever's working there, said, "Oh, do you realize that this test and this test, they're different?" And I wrote down, and my person who was with me chose what test. "Oh, let's do this one." And luckily, she was able to have some time at the end of our shift to give some feedback about our patient, and there was a little bit of discussion. I'm sitting here thinking something's not right, and so I looked at my notes, which I have little sticky notes all over my clipboards, and I did see there's a mistake, and they kind of frantically went, and it wasn't a mistake that's going to harm the person. It would give us more clarity about what's going on and prevent her from having to redo the test and spend more money for office visit and all that. So yeah, with all those people working together, me as a person who's I guess just taking classes and still taking classes, we really remember, it's fresh in our head. But anyways, I'm going to stop this before 15 so that I can see if YouTube can get me uploaded. Thanks.